This is Tristan Cray. It is March 2nd, 2020, and I am doing the total hip arthroplasty scenario 2 for my PTA final competency of spring semester. Okay, I'm going to get started by washing my hands, and then I'll go introduce myself to the patient. There's a bear that eats dark wood, yogi, yogi bear. Cucumber. Yogi likes to eat salad. Cucumber. Cucumber. Yogi likes to eat salad. Cucumber. All right. All right. Good morning.
Good morning.
So, my name's Tristan Cray. As you can see, I'm a student of physical therapy assistantship at Kennebec Valley Community College. And I'm going to be doing some physical therapy with you today. Okay. So, before we get started, I'm going to need to verify your name and date of birth.
Amy Bergen, May 24th, 1982.
You got a birthday coming up.
I do, yeah.
Oh, excited?
Mm-hmm.
Okay, you are the correct patient. And I see you had a total hip arthroplasty. I'm reviewing your chart right now. 10 weeks ago. And can I ask you, which approach did you get the hip surgery done?
The posterior approach.
Excellent. That's what I have
That's what
here.
the doctor said.
Yep, posterior approach. And okay, so before we get started, I'm just going to ask you a bunch of questions that you've probably been asked a bunch of times now, because it's something we have to do every time, just to be on the safe side. So, have you had, since you're, in the recent 10 weeks, have you had any fractures or muscle tears?
No.
No? Okay. Have you had any deep vein thrombosis or blood clots in your body?
No.
No? Okay. Have you had any cancer or malignant tumors?
No.
No. Have you had any tuberculosis or other pulmonary diseases?
No.
No? Okay. And have you had any, I know you've had an infection recently in your, the wound from your surgery, but other than that, have you had any open infections or open wounds?
No.
No? Okay. And I know you had a myocardial infarction 3 years ago, and you've taken medications for that, but since your surgery, have you had any myocardial infarctions, heart attacks, palpitations?
No.
No?
Nothing like that.
Okay, great. So no cardiac contraindications or precautions. Great. That expands our range of exercises that we're able to do. That's really good. All right. So, and on a scale from 0 to 10, with 0 being no pain at all, 10 being extreme pain, the worst you've ever felt, what would you say your pain scale is today?
About a 6.
6. Ooh, that's bad.
Yeah, it kind of hurts.
Well, hopefully we can work that down a little bit today.
I hope so.
Stretching and motion.
Mm-hmm.
Okay. So I'm just going to check in with the PT real quick.
Okay.
And I'll be back in a second, and we can get started on our physical therapy.
Sounds good.
For your crutches.
Oh, yes, thank you.
So I just checked in with patient Amy Bergen. Correct patient. She has a pain level of 6, and no contraindications. She had the posterior approach. I double checked with that. And any other reason why we may not be able to do PT? Any other thing else? Okay, we're good to go. Thanks. All right, so I'm gonna take you into our little gym area for PT.
Yeah.
And you have your crutches.
Mm-hmm.
That sure you're very skilled at using now.
Oh, yeah.
And I'm gonna have you sit down on this chair here. You remember what the date is today?
It is May 2nd, 2020.
Yeah, it is. Yeah. Okay, and do you remember who the president is right now?
Barack Obama.
Yeah, it is. Yep. Okay. I'll take these crutches.
Oh, thank you.
Now, for the posterior approach of hip surgery, we have some precautions that we have to follow. So before we start our exercises, remember we cannot flex our hip to 90 degrees. So you can't bring it up this far.
I like that.
Yep, exactly. We cannot turn inwards at the hip. So if your leg is straight, that's like pointing your foot inwards.
Okay.
If your knee is bent, that's like bringing your lower leg up and out.
Mm-hmm.
We can't do that. And we cannot cross our legs or swing this leg past the neutral point, past where it normally hangs down.
Okay.
Okay. And I'll keep an eye out for that during our exercises. And you, I'm sure I've heard this many times since your hip surgery.
Mm-hmm.
So together we'll make sure that we don't do those things.
Sounds good.
Okay, so before we get started, I'm going to put a gait belt on you, and this is a safety precaution.
Oh.
Alright.
Fancy.
Yeah. Yeah, this is a fancy gait belt.
Mm.
All right, how does that feel?
Good.
Good. Okay. Got a gait belt on. All right. So, first thing we're going to do today is some balance exercises. And I know your main concern right now is improving your ability to walk, and especially to walk up and down stairs. Now, since you're only 50% weight bearing, that's going to somewhat limit our ability to do those real productive exercises for stair walking. But we can still work on overall body balance, which will help you once you get to that stage where you can practice the stair walking and the full body, full weight bearing balance exercises.
Okay.
So it's like we're starting with the core, and then once that's really good and you're ready to use the legs, you'll have a head start.
All right.
Okay, so first balance exercise we're going to do, I'm going to stand behind you here, and I've got one hand near the gait belt.
Okay, good.
In case you lose your balance. And also you can put your foot, I've got a kick stool for you, so you can keep the leg you had the surgery on out a little bit, just to make sure that we don't put the weight on there, and to keep it from flexing too far forward. Now, so what you're going to do is you're going to sit in the chair with your back off of the chair. You're going to cross your arms, and we're going to see if you can balance like that for 15 seconds. And so you're doing it right now. That's great. And how does that feel? Is that challenging?
No, not really.
Okay. Now, to add an extra layer of challenge, gonna have you close your eyes. So can you close your eyes? Great. So we'll do 15 seconds like that with your eyes closed. And while we're doing this, remember to breathe. Okay, great. So now we're going to kick it up a notch. We're going to add another level of challenge. While we're doing this, I'm just going to give you some slight nudges in different directions, and you're not going to know which directions it's coming from. So this is, with your eyes closed, you're working on your vestibular balance, which is really good for a whole body balance. It's the one inside your head that sort of helps you know where your head is in space. And so we're also working on your reactive balance now. So we'll start 15 seconds, and I'm going to just give you occasional pushes in different directions, but I've still got one hand towards your gait belt, and I'm making sure you don't fall.
Okay.
All right, ready?
Mm-hmm.
Go. Okay, great. You can open your eyes.
Yay.
So you did pretty well.
Good.
So I'm gonna make that part of your home exercise program. I'll talk about that later. And perhaps next week or the week after, we can add another challenge into this exercise by having you sit on a big inflatable ball. Yeah, which will really engage your core and everything. So, very good. Next, we're going to stay seated, and okay, for this one, I'm going to be holding out our Beanie Baby friend here at different positions, and what I want you to do is reach out and just touch the Beanie Baby, right? Yep, as if you're going to grab it, but don't grab it because I need to hold on to it so I can, move it around. All right. So I'm also going to be guarding you, watching to make sure you're keeping your balance. So there, okay, great. Oh, and actually, if every time, the idea is so that you're practicing reaching out and engaging all of your core muscles and everything every time you reach out. So it'd be best if you reach out and then once you've touched it, pull back to, the starting position.
Okay.
Great. Okay, great. Oh, that's a good one. Great. Can we try with the other hand now? Did you boop it?
Mm-hmm.
Great. Excellent. So that's really good in working in your visual sense of balance, your eyes with your core and everything. And that's really going to help once we get on to the stair walking exercises, once you get that weight bearing in your foot. So, so now we've practiced balance. We're going to move on now towards strengthening. So, first strengthening exercise we're going to do is with the soccer ball. And we're going to give you this soccer ball to take home. So this will be yours for the next few weeks.
All right.
So what we're going to do is put the soccer ball in between your knees. And remember, we don't want to bring this leg past the midline, right? The leg that you had your surgery on. But as long as the soccer ball's between your knees, that's not going to happen. And what we're going to do is we're going to squeeze the soccer ball. Right? You're bringing your knees together, but the soccer ball's in between them. And so that's really working these muscles here and in here. And we're going to do 15 of those squeezes. And while we're doing this, I want you to count. That way I know that you're breathing.
Okay. So I count with every squeeze?
Yes.
1,
Mm-hmm.
2, 3, 4, 5, 6, 7, 8, 9, 10.
Can I stop you right there for a second? Can I actually have you lean back a little bit because your hip was getting sort of close to 90 degrees of flexion. So I'm going to have you lean back a little bit.
Well, thank you.
That way we avoid that 90 degree zone,
Okay.
which we want to avoid.
Can I start counting again?
Yep, so counting again, starting again at 10.
10, 11, 12, 13, 14, 15.
Okay, great. So I think I'm going to put a pillow on this chair, and that's going to raise your hips up a little bit because as we're doing this, I notice your knees moving up a little bit into that 90 degree of flexion range of your hip that we want to avoid.
Right.
So you just stay right there. I'm going to get a pillow to raise us up a little bit. Okay, if you could, let's see, I'll give you crutches, if you could stand up using that. And I'm putting the pillow down, and now you can sit back down.
No, I ain't tall.
Yeah, so that raised you up a bit, and that helps us avoid that 90 degrees of flexion. And we'll do one more set of 15.
Good?
Yep.
Okay. 1,
Mm-hmm.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Great. So we're going to make that part of your home exercise program.
All right.
And you have a nice reclining chair in your living room, right?
Of course.
Yeah, so we'll give you this, and you can work on that in your reclining chair, and that way we avoid the 90 degrees of hip flexion. Yeah, these chairs are a little not quite recliny enough, but at home you will be fine as long as you're reclining somewhat. Okay. Next exercise we're going to do is using, let's see, where'd they go? Right here. So we're going to be strengthening your hip extensors, knee extensors. That's your quadriceps muscles, and those are really important for going up and down stairs.
Mm-hmm.
Quads are super important. So once we get those strengthened, once you get back to full weight bearing, and we can practice the stair exercises, strong quads will give you another head start. So we're gonna put this under
Under my good leg?
Yep, or just sort of around the ankle of your unaffected leg.
Okay.
Yeah. And you can put that back down. And now we're going to put this around your other leg. And we're going to just try to extend your knee. And you want to stay reclined a bit. You can kind of scoot forward a little bit. There we go, perfect. Now we're definitely avoiding that. And yep, extend your knee. Yep. And you can move this leg a little back to increase the resistance. There you go. Perfect. Yeah, and you can bring your leg all the way back. Try to get that full range of motion like this.
So like that.
Yeah. Yep. And as you play around with this, you'll notice that you can move the other leg around to increase or decrease the resistance.
No.
And remember to breathe.
Mm-hmm.
And we're doing 10 of these.
Okay, so 1.
That was
2.
That was number 10. We'll take a break and then we'll do 10 more.
Okay. So 10 more?
Yeah, take a few deep calming breaths.
I'm so excited about this physical therapy.
Oh, great. I
just want to get back out there so I can climb stairs with my grandson.
Yeah, your grandson. Oh, is he a good stair climber?
Yeah, yes.
Okay.
All right.
Yeah, start whenever you're ready.
Okay. 1.
Mm-hmm.
2.
Perfect. Now that's really what you want to do.
4. 5.
Mm-hmm.
6.
Yep.
7.
Yep.
Okay. 8. 9. 10.
Yep. And if you're going to go out to the side like that, which is fine, just remember that you can't then bring it in past the midline.
Okay.
Mm-hmm. In fact, to prevent that, if you're going to go out to the side like that, you can even put the soccer ball in between your knees. Yeah. So, excellent job with that one.
Thank you.
Next, we're going to do some stretches.
Okay.
So, first stretch, we're going to go up. Actually, I think I'll demonstrate these first before we get you up and on your crutches. So, we're going to be stretching your calf muscles, 2 different calf muscles, and we're going to be also stretching your glutes and hamstrings, and then your quads, and all this will also increase your range of motion and make you better at going up and down stairs. So, first stretch, you're going to put your right leg, the one that you do not want full weight bearing on, will be going forward, right? And you want your foot flat on the ground and you're leaning in. And you're doing that for 1 minute total, so you can break that up to 2 30-second stretches or 3 20-second stretches. And then the second one, you're going to be doing the same thing, but you're going to bend your knee. And same, 1 minute total. And then for the third one, what you're going to do is you're going to again keep your foot flat on the ground. The other foot goes up kind of into the door. Put your weight into the door frame so that you're keeping your weight off of the foot that you're trying to stay off of. And you're going to be bending at the waist this time. And you want to keep both legs straight. And that one, you should really feel the stretch in the hamstrings and glutes. And also you want to feel the stretch, with all these stretches, you want to feel them in the muscle belly. That's like the meat of the muscle. You don't want to feel it in the joints or in the ligaments. You want to feel it stretching the muscle and not, bone or tendons or anything. Okay, so get you your crutches.
Woohoo!
And you can ambulate towards the door. And put your weight into the door frame. Okay. Yep, right foot forward.
Okay, like this?
Yep. And your feet flat on the ground, okay. Do you feel that stretch right in the calf?
Yes.
You do? Okay, great. So we're going to hold that for 30 seconds. And remember to breathe during this, and so I'm going to want you to count.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Great. Okay, so now we're going to do another calf stretch, and that's the second one I showed you, and that's the one where your back leg is bent at the knee. So you're going to try to, yeah, there you go. Perfect. And yeah, so again, for all these stretches, when you're doing them at home, you're going to want to do them for a minute total. So this one, just to speed things up a little bit, we're going to do 15 seconds.
Okay.
So if you could count to 15.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Great, great. And so if you were doing that at home, you'd want to do 4 sets of 15. Now, the last one we're going to do right now is the quad and hamstring stretch. And so to do that, you want to lean forward, bend at the waist, and you can put this front foot kind of up into the door like that. Yeah, there you go. And bend at the waist. And so do you feel the stretch in your right in the back of your right leg going?
Yeah. Mm-hmm.
Okay, great. So I'm going to ask you to count to 15 again for this one.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Great. Okay. Now I'll give you your crutches. There's one. And you can put your weight into that crutch. There's 2. Put your weight into that crutch. And we'll have you ambulate back to the chair. And remember to recline a little bit. And we'll get this for your right foot to... Okay. So there was also a quadricep stretch similar to that, using that same door frame where your your one leg was going to be on a chair behind you, but we don't really have time. That was a little more involved, and there's a little more guarding and everything that's going to be involved. But perhaps next week we can get to that one.
Okay.
And that's also going to increase the range of motion. But those stretches that I showed you are going to help you increase your range of motion and help you get up and down stairs once we get to that stage. So, I have a home exercise program for you.
Great.
Okay. Soccer ball squeezes, as I showed you. 10 squeezes, rest, then 10 squeezes, and we're going to do that 2 times per day.
Okay.
Right? And so I've drawn this character with a TV remote and a phone, and that's showing you that you can do this while you're talking on the phone, watching TV. You've got that reclining chair in your living room, and so you can recline back, squeeze that soccer ball. It's very easy. There's no reason why you can't do this one.
All right.
Yeah. So. Soccer ball squeezes. Now, the balance exercise I'm giving you, the sitting in the chair, arms crossed, eyes closed if you can, and we're going to try to do that one for 15 seconds, 3 times per day, and you can also do that in your reclining chair, which has the armrests, if you're at home for a little more support and safety.
Good.
And now we have the stretches. So we have a hamstring stretch. That's the one where you bend at the waist. This one's really important. I think this one, of these 3, this one's the most important to do. So it's great that you felt that stretch right there. Hamstring stretch, bend at the waist. Stretch felt here in the back of the leg. And that's also stretching, I called it the hamstring stretch, but it's also stretching the gluteus muscles as well. So try to do that for 1 minute per day. Calf stretch, same thing. Leg bent. Calf stretch number 1, leg straight. Calf stretch number 2, leg bent, foot flat for both of them. 1 minute per day for both of them.
Okay.
So, on that same scale that I gave you at the beginning, from 0 to 10, what would you say the pain is in your hip right now?
It's about 4. It feels better.
Great. So, stretching and motion, we lessen the pain. That's perfect. Put that down. So, getting your home exercise program and your soccer ball. Do you have any more questions for me?
I don't think so.
Okay. Well, I look forward to working with you next week.
Sounds good. Thank you so much.
And so now I'm going to go wash my hands and then check in with the PT.
All right.
Have
Am
a great day. You
so
are
I'm
good
free
to
to
go. Yes.
Oh, thank you so much. Got all my stuff.
I'll carry the soccer ball
Thank
for
you.
And I'll take that. And you can give the gate belt to Tom over there.
All right. Thanks. I got it. Thank you.
Okay, I worked with patient Amy Bergen. She started with a pain level of 6 and it decreased to 4, which is great. We started with exercise. We balance exercises. We did sitting, eyes closed, chair balance with some disturbances. She did really well. She's going to practice that at home without the disturbances to the balance. And then we also practice object touching, so reaching forward balance. So we worked on her vestibular and visual systems of balance, proprioception as well, because she was having to engage her core and figure out where her body was in the space. So then we moved on to exercise. We did the soccer ball squeezes, so working on adductor muscles, which are probably weak because she has a adduction limitation, and because she's also been non-weight bearing and had surgery. So I sent her home with a soccer ball, and she's going to practice those adductor exercises, 30 squeezes per day. And then we practiced with a resistance band, practiced knee extension, and I did not send her home with a resistance band. We're going to work on it more possibly in the next intervention, because it was there was a risk of her adducting her right leg past the point, past neutral. So we're going to work on that more and figure out how we can avoid doing that exercise without risking the adduction. And then we did stretches, calf stretches of the gastrocnemius and soleus muscles. We did not have time to practice a full minute with each one, but I gave her a home stretching program to stretch the gastroc, the soleus, and the hamstrings and the glute muscles. And she's going to do a minute. I assigned her a minute of stretching once per day for all of those muscles. And at the end of the intervention, her pain level went from a 6 to a 4. So that was good, and I think it was a productive session. Okay, thank you.